Welcome, everyone, to the Indiana Critical Access CAH Convening Meeting, and Karen Kennedy with the Indiana Hospital Association is going to be welcoming you to the event. Karen?
Good morning, everyone. Thank you so much for attending today. We're so pleased to have such a wonderful attendance. Again, I am Karen Kennedy, and I serve as Vice President of Quality and Patient Safety at the Indiana Hospital Association. I'm just here to give you just a few logistics, and then I will turn it over to the Indiana Rural Health Association. So the presentations were emailed on Monday. There were a couple of presentations that arrived late, so those will be sent out to you either later today or early tomorrow. If you didn't receive the invitation or the presentations, please send your email address to Becky Royer, and she will get them to you. Becky's email is broyer@iha.org. Everyone is on mute to cut down on the background noise. Please, throughout the day, please use your reaction functions, clapping, smiling faces, etc., to give us feedback about the program. And also, please use the open chat. So you should all have access to that. If you have any more technical issues, the IRHA team will be on standby to help you through those technical issues. So use the question and answer function, or raise your hand, or use the reaction function, request to be unmuted for questions throughout the program. And a critical access partner team member will monitor each presentation and make sure your questions are addressed. There will be individual recordings of each session that we will make available and distributed so your hospitals can access them as an individual section, and you can forward those as desired. So now for the agenda overview, I first want to acknowledge all of our partners. First of all, I'd like to acknowledge the Indiana Department of Health and its Office of Rural Health. We would not be here today if it wasn't through the funding of the Office of Rural Health. So thank you to Ann Alley and Joyce Fillenworth for your and David Conrad for your dedication and your collaboration with all the other partners. The Indiana Department of Health Epidemiology Resource Center, Qsource, the Indiana Rural Health Association, and also the Indiana Hospital Association's team. The partner slides, they were rolling throughout the beginning of the program, and they were actually also included in Monday's email. So you have that as well, because we won't be going into detail with each one of those partner slides as part of this opening session. I also want to thank all the presenters for sharing today. I think we have a great lineup today, and we are very grateful for each and every one of you. We also have Brent Anderson, who is with the Indiana Department of Health. I know many of you know Brent. He is a practice coach, and he will lead us through breaks and lunch with some wellness activities. It's imperative that you take care of yourself. And I know we've said that over and over, and I know you tell your staff that. But we want to be able to do some of these wellness activities during the break. So I'm really excited to have Brent here today. And also all of our partners want to encourage you to participate in the activities. So please stay connected throughout the day. Sit back, take a deep breath, and enjoy. The partners developed this presentation and this day based on feedback that we've received through the critical access hospitals. And that's really why we're virtual today. We received feedback that we still needed to stay virtual, just one, because of COVID issues. We know your hospitalizations are still high and that you're faced with many workforce challenges. But we do hope that in the spring, we will be able to connect in person, and we will be able to make a personal connection in the spring. But we have received some feedback that maybe this event will need to stay virtual, and that may be the preference. So we want to hear from you and get that feedback, whether or not it is something that you want to move forward and go in person. So at the end of the day, you will get a survey of the event. And again, we want that feedback. We truly do look at that feedback and listen to what you're saying. And we will have an incentive this time. So we have two $25 Visa gift cards that we will be raffling off to those who actually send us that feedback. So thank you. And that will be a post-event email that you'll receive that link. So again, I wanted to acknowledge and welcome from the Indiana Hospital Association. And just wanted to share just 3 things that were on our PowerPoint slides. One, our annual meeting is next week from November 1st and 2nd. The following week, we are hosting an infection prevention boot camp. We have over 70 participants signed up for that. So that registration is still open. And then I wanted to remind everyone that on December 8th, the Indiana Department of Health is hosting its Labor of Love, where we will be celebrating Indiana's birthing hospitals. So at this time, I'd like to turn it over to Cara Veale, who would like to say a few words on behalf of the Indiana Rural Health Association. Cara, the floor is yours.
Thanks, Karin. Good morning, everyone. My name is Cara Veale. I'm CEO with the Indiana Rural Health Association. Welcome to today's Critical Access Hospital Convening Meeting. The team at IHA has prepared a really great agenda for today. And I want to make you aware of the next upcoming Indiana Rural Health event. It's our fall forum. So this event's going to be at the Ivy Tech Corporate Center in Indianapolis on Thursday, November 17th. We welcome you all to attend. We have a great lineup of speakers as well. So thank you again to Becky Royer at the Indiana Hospital Association, the Indiana Department of Health, the Indiana State Office of Rural Health, and Qsource for continuing these biannual meetings. And I want to thank each of you for your ongoing dedication and hard work that you do each and every day. So at this time, I'll turn it over to Mitzi Daffron with Qsource.
Good morning, everybody. Again, my name is Mitzi Daffron. I am the Task Order Director at Qsource, which is the Medicare Quality Innovation Network Quality Improvement Organization for Indiana. I know you're all very familiar with Don Gettinger and Kathy Moore from our team. We're excited to see so many people joining today. Just want to share a couple of highlights from Qsource very quickly. We have a fairly new area of focus for us in assisting our community partners in implementing culturally and linguistically appropriate services or CLAS standards. CLAS ensures that the services that you and your organization provide are respectful and responsive to each patient's culture and communication needs. These standards factor in cultural health beliefs, preferred language, health literacy, and communication needs. If you're interested in hearing more about this work or want to do a self-assessment of your organization, please feel free to contact us. I'd also like to mention an upcoming webinar with the Indiana Department of Health on November the 9th. Some of the areas of focus include an update again on COVID-19, latest guidance on bivalent boosters and wastewater monitoring. There'll be an update on Candida auris and also an update from the Governor's Public Health Commission. You can find that information and information on the whole webinar series on COVID-19 public health updates on our website at www.qsource.org/webinars. I will put that in the chat here when I'm done. So again, welcome, and we hope that you enjoy your day with the CAH Convening Meeting. And I'm going to turn it over now to David Conrad, who is the Flex Coordinator with the Indiana Department of Health, State Office of Rural Health.
Hey, everybody. Thanks for being here. My name is David Conrad. Technically speaking, the Flex Grant oversees putting on this conference each year. We do it twice a year, and it's one of my favorite things that we do. But by no means are we the ones responsible for pulling all this together. It's everybody working hard together to make sure that we can put on the best possible thing. Now, you'll see me pop in a couple more times throughout the day today. But really, I want to get us kicked off because I absolutely love doing this program. I love all the stuff that we've got planned for today. So I'm going to pass it off to Hannah Gallion, who's going to introduce our first topic for the day.